Human medical knowledge spans thousands of disciplines, from the mechanical alignment of a single joint to the sequencing of 3 billion base pairs of DNA. When the body begins to fail, this massive library of information becomes an immediate challenge. A patient has to navigate a dense network of specialists, pharmacies, and clinics to find a path back to health. To make sense of this ecosystem, we have to look at the interlocking parts, from the ethical codes that govern treatment to the microscopic sciences that make recovery possible. This scale visualizes a medical reality. Interventions cause short-term damage for long-term benefits, accepting calculated risks for survival. To prevent abuse, clinicians follow strict principles. Non-malfeasance ensures treatments do no harm, and informed consent guarantees patients accept the risks before a single dose. These ethical guardrails ensure that modern medicine remains a service to the patient, rather than an exercise in reckless experimentation. When these principles are put into practice during a crisis, the system mobilizes. Paramedics and emergency departments act as the first line of interception, focusing entirely on stabilizing life-threatening trauma. Once stabilized, intensive care units and surgical teams take over. They manage failing organs and repair structural damage to keep the body's vital systems functioning. This emergency infrastructure exists to buy time. It provides a window for the medical system to perform its next function, translating symptoms into a definitive diagnosis. A high fever or a localized sharp pain can signal 1,000 different pathologies. To identify the specific cause, doctors have to look past these external signals. Investigation moves inward. Laboratory tests analyze the molecular makeup of the blood, and biopsies examine the behavior of cells. And imaging technologies, like MRI and CT scans, provide a direct view of the internal architecture. Diagnostic medicine turns a set of vague physical complaints into concrete data, allowing the system to route the patient to the specific expert they need. Because the human body is too complex to master, medicine is partitioned into specialized zones. Cardiology handles the heart. Pulmonology focuses on the respiratory system. Other fields, like oncology or gastroenterology, deal with systemic disorders impacting multiple regions at once. This compartmentalization allows the medical field to apply a high level of precision to every unique system within the human organism. There is a persistent anomaly in medicine called the placebo effect, where a patient's health improves after receiving a fake treatment, simply because they genuinely believe it will work. This bar chart shows the high standard of modern science. To be considered an established medical treatment, a new drug must mathematically outperform this baseline placebo bump. If it cannot prove its efficacy in a controlled trial, it is rejected. This reliance on objective, verifiable proof is what distinguishes evidence-based medicine from unproven alternative therapies. These clinical specialties only exist because of a deeper layer of bedrock science that operates at a microscopic level. Anatomy provides the map of our physical structure. Physiology explains the chemical processes keeping us alive, and genetics provides the code that dictates how our cells grow and replicate. These foundational truths are what allow pharmacologists to design new drugs and surgeons to invent more effective procedures. Medical practice also evolves alongside the patient. It moves from the rapid developmental milestones of pediatrics to the chronic management and frailty considerations of geriatrics. The goal of the system shifts over time, moving from maximizing a child's growth to maintaining the dignity and comfort of a patient in palliative care. This represents the years-long gauntlet every new drug must survive before reaching the public. Out of thousands of compounds discovered in labs, only a fraction will pass these 4 distinct phases of clinical testing. Phases 1 and 2 focus on basic safety and dosage. Researchers test the drug on small groups to ensure the treatment isn't more dangerous than the condition it aims to cure. If the drug is safe, it moves to phases 3 and 4. These involve thousands of participants to prove the drug works better than a placebo and to catch rare long-term side effects. To process this massive influx of data, researchers use biostatistics, applying rigorous mathematical models to ensure the results are accurate. This cycle of constant testing and verification ensures that medical protocols are refined based on data rather than intuition. Individual specialties, foundational sciences, and clinical research all work together to form a coordinated defense against disease. By mapping the body and the sciences that support it, we have turned a chaotic biological struggle into an organized, evidence-driven system of care. From the paramedics on the street to the biostatisticians in the lab, this massive collaborative network ensures that we no longer have to navigate illness in the dark.